Today we're here to talk about post-SSRI sexual dysfunction, otherwise known as Pssd, which is a debilitating condition that is characterized by persistent sexual dysfunction that occurs following the use of an SSRI drug, which is a type of antidepressant. So Pssd is a condition where individuals experience persistent sexual side effects after stopping the use of SSRIs or other antidepressants. Now, throughout this video, we'll explore the current research around Pssd, the science behind how we think it's actually triggered, and a little bit more details about potential treatments. So, Pssd symptoms can include genital anesthesia, so numbness of the genitals, erectile dysfunction, and orgasmic or ejaculatory anhedonia, which means that following ejaculation, there is actually no pleasure sensation. It feels completely numbed and blunted. Additionally, there have been non-sexual symptoms such as anhedonia, apathy, and blunted affect. Pssd occurs after stopping serotonergic antidepressants such as SSRIs, SNRIs, and TCAs or tricyclic antidepressants, and is recognized as a persistent medical condition by the European Medical Agency. So how can Pssd impact quality of life? Pssd can severely impact quality of life by causing persistent sexual dysfunction, including symptoms like genital anesthesia, erectile dysfunction, and orgasmic ejaculatory anhedonia even after discontinuing SSRIs. This leads to significant distress and a profoundly negative impact on overall well-being, with many individuals rating the effect of Pssd on their quality of life as extremely or very negative. What about the prevalence of Pssd? Now, even though the first documented case of Pssd was in 1991, and there is generally a lack of research on the prevalence of Pssd, however, it does seem to be quite infrequent. One study estimates the risk of Pssd is about 1 in 216 men using SSRIs measured through use of PDE5 inhibitors such as Viagra. However, this study only looked at use of PDE5 inhibitors, which may not fully capture Pssd symptoms. It is also hard to estimate Pssd's prevalence as people may be unlikely to talk about sexual side effects generally, and it is often not explicitly measured by psychiatrists and doctors. A study published this year on continuing sexual issues in a sample of males and females found enduring sexual side effects for 13.2% among antidepressant users. While sexual side effects are certainly quite common when taking antidepressants, it does seem like most people return to normal functioning.
Real quick, do you feel like your current supplement stack isn't quite cutting it? If so, then you might want to check out my brand new supplement, Catuaba. Catuaba is a remarkable, lesser known Amazonian herb that has been used for centuries to support energy, mood, and libido. Scan the QR code on your screen to discover how Catuaba can take your supplement game to that next level.
Now, when it comes to the major causes of Pssd, there are many different triggers, and they don't actually have to be pharmacological. They can sometimes even be supplements. So, for example, ashwagandha has been known to afflict people with these symptoms. Supplements such as St. John's wort, that can also trigger Pssd as well. Now, the exact neurobiological mechanisms are unclear, but proposed theories changes to brain modulators. So changes in neuroactive steroids such as allopregnanolone, neurotransmitters, and gut microbiota. Now, it might also be that post-finasteride syndrome has a similar mechanism as Pssd, which is covered really nicely in this paper here. It's also important to note that some antidepressants have lower sexual side effects than others. However, literature has not been conducted for Pssd. Now, despite this, it seems generally antidepressants which work specifically with serotonin have higher rates of sexual dysfunction while actually taking the antidepressants. For example, this study found bupropion instant release and bupropion sustained release and nefosodazone were associated with the lowest risk for sexual dysfunction, whereas selective serotonin reuptake inhibitor antidepressants, mirtazapine and venlafaxine XR, were associated with higher rates of likelihood of developing Pssd. So what about possible treatments? It's important to be really clear that at the present point in time, there is not enough research on how to treat this particular condition successfully in 100% of cases. And there's generally a paucity of studies. Now, I've managed to find at least 6 studies which present potential treatments. However, several of those are single patient case studies. So let's take a look at what's been found to work, keeping in mind that there's no real large sample studies at this point. So I'm going to present the potential treatments from least strong evidence to most strong. Possible treatments: low power laser irradiation, which is a therapeutic technique that uses low energy laser light to stimulate tissue healing and improve cellular function. In this case report with a single patient, the laser was applied to the penis over 20 sessions. The aim is to enhance blood flow, promote nerve regeneration, and alleviate symptoms related to sensory deficits. In the reported case, the light stimulation resulted in a partial restoration of penile sensitivity, specifically improving touch and temperature sensations by 20% and 40% respectively. While it showed some effectiveness in addressing sensory issues, it did not resolve other sexual dysfunctions such as anejaculation and erectile difficulties. This suggests that while it can help with certain symptoms, it may not fully address the broader impacts of PSSD. The next possible treatment is something that you may be familiar with, which is actually oxytocin. Now, in a study modeling these effects in male rats, various doses of fluoxetine and SSRI were administered and sexual behavior was observed in chambers designed to assess both sexual desire and performance. Now, results showed that fluoxetine decreased ejaculatory responses in a dose and time-dependent manner without affecting copulatory efficiency. Now, the administration of oxytocin itself restored the ejaculatory response to baseline levels, but did not fully recover sexual excitement. This suggests that serotonin suppresses ejaculation by disrupting oxytocin's role in sexual behavior, indicating that co-administering oxytocin could help alleviate the predominant sexual side effects associated with SSRIs. Now, obviously, this is a rodent study, and it is one of the first studies to look at the use of oxytocin. The next intervention is multiple at once, which is looking at this study, which was really interesting and was essentially a mixture of therapy as well as supplements that may help with sexual performance that we'll go into. Essentially, this is a study of 12 men with PSSD, went for a 6-month-long study and consisted of many interventions, including L-arginine supplementation at 3 grams a day, which is an efficient donor of nitric oxide and may help restore erectile function by enhancing nitric oxide pathways, counteracting the serotonergic inhibition caused by SSRIs, especially when combined with PDE5 inhibitors. L-carnitine supplementation at 2 grams a day, which is a nutrient essential for energy production, can mitigate chronic fatigue and improve cardiovascular health, which may enhance male sexual function. It also shows potential in treating erectile dysfunction by reducing oxidative stress and supporting mitochondrial function. L-citrulline, another supplement, has demonstrated effectiveness in treating PSSD in individual cases. Buspirone was also used for some of the men and is a 5-HT1A, aka one of the main serotonin receptors. Partial antagonists typically used for anxiety may help improve sexual function by counteracting serotonergic inhibition, and Viagra was also prescribed if needed for some of the men. Mindfulness training was also used and encourages awareness of the mind-body connection, aiming to reduce anxiety and enhance sexual experience. Cognitive behavioral therapy was implemented to address negative thoughts and helps patients cope with PSSD, often involving partners to foster understanding and support. Finally, sex therapy was used to educate partners about medication side effects and promotes pleasurable experiences rather than focusing on performance. Importantly also, all participants stopped smoking, drank less than 2 alcohol units a day, and exercised 4 to 5 times a week, and also didn't smoke. All markers of sexual dysfunction improved between baseline and post-treatment. This indicates that it does potentially take a multi-intervention approach. Now, what about pharmacological interventions? The final human study I've included involved a sample of 13 men with PSSD who either received bupropion, vortioxetine, nutraceuticals, or a combination of these. While this study design was quite weak as there was no control group and many of the men had different treatments, there was still some interesting findings. Most patients after treatment with vortioxetine by itself or with nutraceuticals reported a significant improvement in erectile functioning after 1 year. So what is vortioxetine? Interestingly, vortioxetine is another antidepressant which has been quite recently developed and was used in this study, as it may improve the serotonin to dopamine ratio even though it does increase serotonin. This is really interesting and does warrant more research. In one study where patients experiencing sexual side effects from using different antidepressants switched to vortioxetine, 83.81% of participants noted an improvement in sexual functioning. Of course, any decisions, particularly around mental health and antidepressant medications, needs to be made in conjunction with your doctor, and there are people on Reddit and the Pssd forum who did not have good effects from vortioxetine. So that pretty much wraps up today's video on post-SSRI sexual dysfunction, which is a bit of a mouthful, but I wanted to actually hear from you guys below. What are your thoughts on this particular topic? Have you used anything successfully that have sort of helped your symptoms? Please leave a comment and let's get a discussion going down below. I'll see you guys in the next video.